So I'd like to call this Social Services and Housing Committee to order. And does anybody have a declaration of pecuniary interest? Seeing none, we'll go to item number 2, our delegation, which was supposed to be at 1:30. Anyway, welcome. And it's the Task Force on Crystal Meth and Other Drugs is the topic.
Thank you for seeing us today.
And can you tell us your names, please?
Certainly. Do I have this on?
I can't see from here.
Perfect. Thank you so much. So again, thank you for the opportunity to be here today. My name is Barb Fady, and I'm the Director of Grey County Social Services, and I have with me today my colleague, Alison Govier. She is the Crystal Meth and Other Drug Task Force Coordinator. We're missing one of our co-chairs, Dave Roy. He is the Program Director for Addiction Services at Hope Grey Bruce, and unfortunately he couldn't be here with us today. We have an overview to present to you with regard to the work that is happening at the task force, and we'll move through the presentation. We'll have some time for questions, but what we have today for you is some information about where we come from and where we're going to. So special thanks to Director Christine McDonald as a participant and supporter of our task force, as well as to Councillor Paul Eagleson and Councillor Robert Buckle, both as well participating at our task force, and we very much appreciate the support. And again, thank you to Bruce and Bruce County for the support that they've had with us for a number of years. So we'll move into the actual presentation.
So as you may know, Bruce County has been investing in the task force since 2009 and was one of the original founders of the task force. And so we're here to give a bit of an overview, as Barb said, of what we've been up to and where we're going. I'm going to guide our presentation using PowerPoint. Anyone have any suggestions on how to move it forward? Maybe if I could just get a show of hands of who has been around the table long enough to have been at the table when the task force first formed back in 2009? A couple. Okay, yeah. All right. So as you know, the task force formed in response to some very devastating and serious concerns from family members about the presence of crystal meth and crystal meth labs in Grey and Bruce counties. At that time, oh, great, okay. At that time, community leaders came together to tackle this very complex and very devastating issue in our community. Some of the concerns that were being raised were, the highly addictive substance, the impact on health, petty crime and vandalism were increasing, costs of healthcare and enforcement were increasing as a result, and it was just a really scary time for families. Bruce County and Grey County stepped up and funded the task force at that time and have continued to do so to the present day. Today, our partners look like this. I've just included some of our key stakeholders. Over the years, our membership has expanded, as has our mandate. So at first, it was very focused on crystal meth, and we have evolved to also look at other substances within our community because we know there absolutely is a need. So right now, how we're describing our work is we're a coalition of community partners working to reduce harms related to substance use. So just to give you a few examples of some of the work, we're based on a 4-pillar approach. Now this is an approach that is being used all over the province. We have adapted it to include 3 pillars, so making sure that we're working collaboratively with enforcement, treatment services, prevention, and harm reduction. And we'll just pick out, so these are some of the activities listed that we've been engaged in over the last number of years, but we're going to pull out just 2 or 3 just to give you more of concrete examples of how the task force has been making a difference in communities.
So some of you would have participated with us in the My Part series, and My Part series, My Part 1 and My Part 2, were initiatives that were developed to provide supports and tools for service providers who work with persons with addictions, but they're not necessarily an addiction service. So I would speak to my caseworkers in Ontario Works, the children's services staff. Certainly they come across folks who have addictions, whose family members have addictions. And we needed some tools. We needed to provide some tools to those staff to be able to help them and to be able to have those discussions, have those important conversations. So we had 2 initiatives, and the reason we called them My Part is because we do think that all of us who work in community have a part to play. We have a part to address the situation and find a way to help. So the other one I want to highlight is the Drug Endangered Children Protocol. It's a Drug Endangered Children Guidelines, I guess. It started out as a protocol, but it's an actual document that allows for multiple parties, including Bruce Grey Child and Family Services, social services, health agencies, policing agencies, all of us to operate under a certain framework when children are involved and drugs are involved in that home. So we needed to come together with some common principles, and we have more work to do on this particular set of guidelines, but we're very impressed with the work we've done to collaborate, and we celebrate the fact that I believe we're the first in certainly Ontario to be able to develop guidelines, and we're now being, our guidelines are being used as a protocol and a prototype for other communities that are struggling with some of the things we've dealt with as well.
And one other example that I'll highlight is the Addiction Court Support Program. Now, this is a program that was established by the task force back in, I'm going to say 2012. And the task force invested in 1 new position, an addiction counseling position, within Hope Grey Bruce that was to work with the court in Walkerton. And this counselor would provide rapid access to treatment for people who were being charged with offenses that related to substances. And so that is a brand new position that was created, and then it was replicated in Owen Sound. So 2 positions in total. And after the second year, the LHIN actually stepped up and recognized this as a program that was impactful and ended up funding the 2 positions and continues to do so. So this is an example of the resources coming from both counties and really making an impact on the mental health resources that mental health and addictions resources that we have in our communities. So we recognize that it's important to take stock of where we've come from and also where we're going, and to continually reevaluate what the needs are in the community. So that's the phase that we're in right now. We know that there's a lot of work to do. There's still work to do around crystal meth, absolutely. We're not seeing the meth labs that we had seen in the past, but we know that there is still a presence in our community. We know that there are other substances that are also, that require our attention as well. I threw up some stats here just to provide some context. We know that in Grey Bruce, the heavy drinking is higher here compared to the provincial average. We know we don't have local stats around cannabis use among young people, but we do know that in Western Ontario, 1 in 4 students are using cannabis. 1 in 5 and 1 in 4 are using alcohol. And we understand the risks to brain development for any youth under 25 using substances. I could go on and throw out additional stats about other substances, but I think the point I'm trying to make here is that, addictions and substance use is really, it's important to look at it through a health lens. What are the underlying factors that put someone at risk for using substances? And that's the direction that the task force is hoping to take as we move forward. I've thrown up some other stats here related to social determinants of health. So, someone's environment and their life circumstances can really impact their ability to make good decisions about their health and well-being. So it's important that we keep those in mind when we're developing new interventions. So some of those determinants of health would include, affordable housing, food security, poverty, gender. So I guess what I'm trying to say is there's still a lot of work to do. And what we have done over the last year is the task force has hired a coordinator, which is me. And I have been doing some community consultations to get a better understanding of what the current needs are in our community. The goal here, again, is to really frame this substance use as a health issue and to engage stakeholders that maybe hadn't been engaged formally in the past, but really connecting with pharmacists and physicians and EMS. So we've been doing a lot of work around engagement and re-engagement, as well as working on our governance model. So I don't know if you can quite see, but we have changed our model a little bit so that we can be more nimble to the community needs. So we've created a steering committee, which can make some decisions as we move forward and as we have emerging information coming up. And then on the very left there is a research working group that we are convening for the first time this month that includes community stakeholders as well as people with lived experience. So some of that research will help guide what our next priorities are, and then you'll see those other circles there are priorities to be determined. So this is the overview of the way forward. As I mentioned, we'll start with this community-based research and then work on, engaging the right stakeholders in interpreting and using this information, and then moving forward with some new projects, new pilots, and perhaps some rebranding of the task force. In the meantime, and you'll see that the arrow along the bottom there, ongoing strategic investment in community initiatives, that just recognizes that there is a lot of really good work going on in our community right now. We look at public health has the Clean Needle Exchange, the hospital has a rapid access addictions clinic. There's a lot of work going on, so we want to make sure that we're supporting some of this work as well.
So we know that that was at a very high level, and I think our message is that the task force was, as Allison spoke to earlier, specifically developed to deal with the devastating effects of crystal meth, but it's become more and more clear that we have a number of other challenges in our community. Some communities are suffering from the use of cocaine. We have issues developing elsewhere from OxyContin and other narcotics. Communities are, the one thing they have in common is that people are in trauma and they're finding a way to cope. They're self-medicating. And we need to dig a little deeper and work more closely with our partners to help support and provide it through a health lens. And so that's where the task force is heading. And again, we thank you for your help. We presented at Grey County Council on Tuesday, and we're grateful to be given some time today on your busy agenda. And if you have any questions you might like to ask, please feel free. And that would be it for our presentation. So thank you.
Sorry, that's very good. Does anybody have any comments or questions? Mike?
Thanks, Madam Chair. Thanks for the presentation. I sat on it for a number of years, and I know it's really, to my, what I see here now, it's really matured into an organization that's got some goals and some plans. So I know we sat there often and struggled with how really to address these things in our community, and it's nice to see you starting. Nice to see how it's moved forward. But we always, and I know there was a problem in Perth County at one time, and the provincial government stepped forward and put a lot of money towards that. And historically, we would go down each year there to the minister and say, we've got an issue. The province has got to come and help us. And it's nice to see the LHIN step up, for sure. But I guess my question would be, is there other things that we could do if we had more financial resources? And I'm sure the answer is yes, but specifically, what would it be?
Sorry, can you just repeat the last part of your question?
I was trying, is there specific issues or things that we could deal with if there was more money available? Problems that we can't deal with now because of underfunding?
That's a loaded question. We know that the mental health and addiction sector is largely underfunded, and we're working in a rural area where, you know, we get a small slice of the pie. I don't see a large influx of funding coming from the ministry for resources towards mental health and addictions. So it's hard to start to dream at this point. But yeah, so specifically.
No, I apologize. I know that's kind of a hard question to answer because it's always yes. If you got more money, you think you can solve any problem. But I know we struggled at that time to say, and the first real idea was that court case intervention officer, and it's so nice to see that the LHIN has stepped forward and funded that.
Right.
And because I think we had one at one time, is that right, Barb? And yeah.
Yeah.
Thanks.
Yeah.
I would just add to that as well that we are so grateful for the work that happens on the ground, and it's coming through in the outcomes. And that's why we did end up with the additional funding being flowed to Hope Grey Bruce, because we could prove that we are making a difference. And do we think if there were more treatment beds, we would be able to fill them? Absolutely. Do we think that we have the answer here in Grey Bruce? No. The issues for us, though, go back to that other slide where the statistics were. We have a lot of people living in poverty. They struggle every day just to be able to get through the day. So sometimes self-medication is what happens. Other times, we know of stories where there's injury during playing sport, and because of some prescription practices, some people are overprescribed, and suddenly you are developing a need for medication that you never had before. So it's complex and it's multifaceted, but what's underlying a lot of it is the trauma. So as Allison mentioned, there are people that are dealing with an awful lot of stressful situations, and if we had mental health, and the counseling piece is certainly much more in need at this time than we've ever seen before. And we're not alone. This is across the province, it's across the country. And we recognize that if we can help our youth, we can help their future and that trajectory. So the youth dollars poured into that mental health piece is where we'd like to see some focus as well.
Any other comments? This is my first time I've really heard a presentation by you, and I think it's very interesting. Your statistics and anything I've been at in the healthcare field states that mental health and addictions is really, really underfunded, and we all know of families that are in crisis and sometimes have great difficulty finding any help. So I was wondering, do you go to local councils at all? I think it would be very beneficial if you would come to our municipality of Kincardine Council, just for general awareness. No funding, of course, but just general awareness.
Yeah, we can absolutely do that. And if anyone else has similar requests, I have been spending a great deal of my time doing education, awareness, and just developing relationships over the last few months, and I'm happy to continue to do that because we always learn more. And it's good to go to the community and understand the needs of the community by being there and talking to folks. Yeah.
Right, and I think it just educates, if you come as a delegation, the broader community with their TV audience that we seem to have, for good reasons and for bad maybe, but we do have considerable, and I think it would be helpful. Thanks for your presentation. So next we have 3A, and it's an action item. It concerns the Rental Agreement Resource Center in Port Elgin, and Christine will inform you on this.
So thank you, through you, Chair. We have a recommendation before you to introduce a new bylaw authorizing the execution of a lease for a rental agreement. This is where the Port Elgin Resource Center is located, and we've been there for a number of years and would like to extend that lease for a small increase to the budget of $180 in 2017. It does give us opportunity to give notice at a 60-day period.
That's a tough amount of money. Could I have a mover and seconder for the recommendation? Okay, moved by Robert, second by Milt, that a bylaw be introduced authorizing the execution of a lease agreement between the Corporation of the County of Bruce and Ray Fenton to provide rental space for the Bruce County Resource Center. All in favor? None opposed, that carried. So next we have information items, and the first one is the Ontario Early Years Child and Family Centers, the service planning investment for 2017.
So I have before you the limited amount of information that we have at this point in time with regard to an investment that we will be receiving from the province. At a high level, they've explained to us that it should be used for planning and implementation of the OEY CFCs. And so the budget that we brought forward earlier today did include using this investment towards our 2017 budget. And I'm happy to take any questions that you might have in regard to the report.
Does anybody have any questions or comments on the OEY CFCs? It took me a while to figure out the tail end of what that was about, and I have to refer back all the time, but any comments? Okay, the recommendation is just that the report be received for information. I don't think we need any mover or seconder, so we're on to the Community Homelessness Initiative Program update.
Okay, and again, before you, we've received information that there will be an increase to the funding that we receive for the Community Homelessness Prevention Initiative Program, which is good news. We've had to very carefully monitor the spending in this program to make sure that we could adequately fund all quarters of the year. So this is the program that does assist people with utility arrears, rent arrears, moving, and all sorts of costs related to stabilization of housing. So we will receive some additional funds with regard to that program. When I had written the report, we had received information up to 2019, and just today we've received another letter that they've confirmed their commitment for 19 to 20. So there will be further information coming with regard to that funding commitment as well. At this point in time, we have now included the additional funds that we're receiving for administering this program to the budget as well too, and so there's $7,857 that will be offsetting staffing costs within our existing budget through this program. And I'm happy to take any questions.
Does anybody have any comments or questions? I just had one on the past one. The early years one, the new administrative funding should take care of our kind of, we had a funding gap before. Will it take care of it 100%, or is it just for 1 year, or will it continue?
So through you, Chair, this is investment in planning funding. So it's a one-time funding that can only be used for the bullet point items that are indicated in the report. It can't be used for ongoing programming. That being said, we still expect that very early in 2017, we will receive our funding allocation that indicates what our future will be in that program. And additionally, the removal of the one position in transition that was in the budget reductions earlier today was a vacant position in that program. So we've already started to position ourselves to remove that over expenditure that was happening in that program should we actually have a reduction in funding.
Okay, thanks. Sorry, I forgot to ask it earlier. So this is reports for information. Any further comments on the homelessness initiative? Then the next one is the Wage Enhancement Grant and Home Child Care Enhancement Grant funding update.
So again, Brenda has a report that she's prepared that explains what has happened with the wage enhancement program. So in the first year of operation, essentially it was a $1 per hour wage enhancement that went to the childcare workers. In the second year of the program, that increased to $2 an hour. And also increased for the home child care providers. So this is just highlighting that difference. And so, of course, it has made an impact for those individuals that are receiving those additional funds. We've had complete take-up in the County of Bruce, so all child care providers that were eligible to be in the program are in the program, so it's 100% take-up. We didn't fully utilize what the province had allocated to us, but there was no further utilization that we could do, and so it just explains how we did utilize the funds.
Any comments or questions on that one? Okay. The next one is the Bruce County Community Housing Registry waitlist update.
Okay, so I do have a report before you that Tanya Dixon, the Housing Services Manager, has prepared. And you'll see that the format of the report is a little bit different this time round. She has indicated a comparison for you between the as at September 30th, 2015 and now at September 30th, 2016. So you do have some comparison data there. And of course, our high waitlist areas continue to be along the lakeshore as well as Brockton and South Bruce Peninsula. I'm happy to take any questions if you had any.
Does anybody have any questions for Christine? It's so that it's the number that are on your wait list kind of surprised me in each area. And with Kincardine, Brockton, and Port Elgin. And Wyerton, was it? Or South Bruce Peninsula?
South Bruce Peninsula, which mainly would be the Wyerton listing, because we don't have rent geared to income housing in Sauble Beach. Yeah.
So there continues to be the gap. Okay. And E is the Canadian Mortgage and Housing Corporation Affordable Rent Innovation Fund for information.
And again, Tanya Dixon has written a report so that you have for your awareness that there is some new funding that's available through Canada Mortgage and Housing. The Affordable Rental Innovation Fund is for new, different ideas, and there has to be demonstration of growth and innovation. So it is something that needs to be a well thought out plan and really have opportunity to do something different. So funding a project similar to something we've already done would not be acceptable or considered something that they would look at. So it really is new, innovative ideas, but that is there for your awareness and information at this time.
Okay, thank you. Any more comments or questions for Christine? So our next meeting is December the 1st, 2016, and I need a motion to adjourn. Moved by Robert, second by Mark. All in favor? And we are adjourned.